Welcome to Sage Women, the podcast for midlife ladies navigating perimenopause, menopause, and healthy aging. I'm Melanie White, and each week I talk with experts and women sharing real stories, practical insights, and smart tips to thrive through this stage of life and beyond. Hello. It's Melanie White here on the Sage Women's podcast, and I'm really excited to introduce today a honours graduate in psychology and a health coach named Gina Gruber. Gina, welcome. Thanks for being here.
Thanks so much for having me. I'm very excited to be joining you.
Yeah, and for people listening today, we'll be talking about women's health and particularly in the context of regional and remote areas. And Gina will be talking about some of her experience in both of these areas and what we might need to consider when reaching out and helping women in isolated areas. So, Gina, to kick off, we'd love to hear a bit about your story, your personal story, your background, and how you got into psychology and then coaching.
Oh, well, thanks so much. Yeah, I think psychology has just always been something I've been fascinated with, understanding behavior, understanding we as people, why we do what we do, what kind of encourages us to make the decisions we do. So it's always been a fascination, I suppose, just society as well as individual. And that led me to study psychology. It led me along to work, in it for a while. And then to kind of go more the individual health route as well. Now, along the lines of understanding what's going to change behavior to help people make better decisions for their health and well-being. So often it's that, we have the information there that we need, but we aren't making the right, we're not implementing it.
Yeah.
So just understanding what's causing that. Why is it that we don't? So yeah, it's a fascinating area. And always learning the more people you work with and the more interactions you have from an individual and a societal point of view.
What types of people do you work with these days?
So generally women, I think since I started working as a health coach, I've worked mainly supporting women through just having to kind of do it all in a way. Often women are the ones who are prioritizing other people's needs.
Yeah.
So it's trying to support them to look at what they need to do to keep themselves strong, to keep themselves able to function, and then able to support the other people in their lives if they need to. So that's generally where my focus lies.
You mentioned earlier that it's hard to change and why don't people change and what gets in the way? And what might be some of the common challenges that women are facing? Women who are busy, juggling a lot of balls, perhaps putting other people's needs ahead of their own.
I think often it's kind of, it can be ingrained beliefs coming even from childhood around various different things around focusing on others, looking outwardly, doing to helping people. And you often find that when you start talking about, well, imagine you were the person, a friend, how would you treat that person? What would you say to them? And suddenly the whole way of the language that you use if you were somebody else is very, very different, which is very fascinating. So there's so many different things that can play into that. But yes, quite often it seems like it's ingrained things that people aren't even aware of that come throughout their lives. And it's just really creating awareness for somebody that that is what they're doing. And, is that working? Or is that something that needs to be then re-looked at and readdressed?
What do you think the tipping point is for people to come to see you? Is it something that's happened in their life? Is it a stage of life that they go, actually, I've had enough, I need to do something?
Yeah, normally it will be something where they really have broken down and they've now gotten, some kind of illness. It generally gets to that point before they actually come and take action. I think it's something, and that's, what I'm trying to now also change is to get people to start that work before that happens. And it's hard because it's something that we don't necessarily prioritize ourselves yet until it gets to a point where it's, oh my gosh, I actually now have to. Now the doctor's told me that I have to do something about it, or, my health is actually failing. So it becomes a necessity. So that's what I'm trying to look at the moment as well, is how to incorporate that into other areas, through different collaborations or reaching out and trying to change that mindset around being able to care for yourself and be able to make sure you take that time to really make sure that you are taking care of yourself.
Mm-hmm. And I think, I'm not sure of your experience of this, but in Australian women, I'm going to speak generally, but not on behalf of everybody, of course. We grew up with this generation of mothers with a stiff upper lip about a lot of women's health concerns like menopause and other things. And we must soldier on and, she'll be right and don't get bothered by it. And you've got better things to do than feel sorry for yourself. That was kind of the conditioning that a lot of us have had. So then when it comes to the way we behave and our values and beliefs, I think some of those sorts of things are ingrained, that we must just keep going no matter what. And it's all about everyone else, but also not to speak up. Is that
Yeah.
kind of the experience that you've had as well?
Yeah, yeah, absolutely. I mean, that exactly talks back to the those ingrained beliefs that you might not even really be aware of. But when you start to really look at, where has this come from? Why is it that I'm not speaking up and saying, okay, this is enough. I need to prioritize myself. I need to take care of myself. Whereas you wouldn't have that same approach if you were talking to anyone else. You'd be much more supportive. So yeah, absolutely, that can come from those. And like you say, if that's the kind of Australian way, having been brought up, then that is very understandable that that's how people are feeling.
Mm. I'm wondering if there's a particular area that you feel has the biggest impact on women's lives. Is it exercise or sleep or nutrition or managing stress? Or is it a combination? I'm just curious as to the patterns that you're seeing and where women might think about starting to have the biggest impact on their lives for the least amount of effort. Well, not least amount of
Yeah.
effort, but the lowest cost to themselves.
Yeah, absolutely. I mean, I think that's the thing. Everything really has such an impact on each other that you can't really look at it in isolation. And I suppose in the past, that's where there's often been difficulty is, you know, if you, let's say you're trying to lose weight, or that's the kind of symptom that eventually brings you to working with somebody, working like, for example, I've had clients in the past where, okay, it's weight loss. Now they need to lose weight. That's what their primary goal is. But when we start really looking at what's going on in their life, to actually put the changes in place, the nutritional changes, is just too overwhelming for them. Maybe they just don't have any time. They need to find that time. So it's looking at, what are they doing with their time? Where is it going? Is all of it actually being productive? Can they carve out 5 minutes that will actually just help them find calm for a few moments and bring themselves back to a feeling of less stress and more in control and more peaceful? And it can be short little bursts. So it's helping people just find that often to start feeling a little bit more, okay, I can take on something different. Because I think often it's overwhelmed. You feel overwhelmed with all the different things, and adding a new now way of having to prepare food, or manage your life, or add in exercise, you're just actually too exhausted and you can't mentally go through that. So it's very much the mental
Mm.
approach to it, and shifting that mindset around how you approach it, and feeling that you can, you know, tackle these new things, and just doing small steps at a time, not being overwhelmed with the big picture.
As you're talking, I'm just thinking about the value of those little 5-minute brain breaks, creating a bit of space. And I think I'm hearing you talking about building a sense of capacity and capability. I can do this. I do have space. Creating those calm moments to just chill the nervous system a bit and reduce the overwhelm and to start seeing the possibilities for change.
Yeah, absolutely. Absolutely. And it's those small things that can actually just make such a difference as you start doing it and implementing, these new things into your life where you feel, oh, actually I can do it, and then you start feeling that way and then you can, those little small wins become bigger and bigger and then you're in that more positive mindset and then yeah, the world's your oyster.
Yeah, it's interesting, isn't it, that a lot of people do go to, oh, I need to sleep better, I need to do this, but it actually does become another task or can be perceived as another task on the to-do list that's too difficult to think about, and decision fatigue comes in. And but actually, as you say, it's the mindset and the way you're thinking about things and your beliefs about what you can and can't do that really drives that behavior change.
Yeah, absolutely.
And especially at midlife, we've got so many competing priorities. So thinking about the overlay of menopause, of relationship breakups, of caring for elderly parents, or helping kids to grow up and leave school, there's actually so much taking up our space as primary caregivers, isn't there?
Yeah, absolutely. And that also plays into the mental space. You've got worries, you've got things that are playing on your mind, all those extra responsibilities. So I think that's where that mental clarity and space and just giving yourself that, a bit more self-understanding and self-love and kind of, oh, okay, I am only human. I can do what I can do, and I need a bit of support myself. So
Mm.
that plays into it definitely.
It's an interesting concept, isn't it? Self-love. I always think of Louise Hay when I hear that word, and I wonder if people, how many people actually have a grasp of what that means for them.
Yeah, I mean, I think that's the thing with any terms. It can mean so many different things to different people, and I think in now as well with the access to information and people talking about these type of things, often it can also feel a bit overdone. That's what I pick up with people often. It's kind of, oh, I don't want to. It's just a bit. It's out there and it's a bit too much. Whereas it's what does it actually mean to you? It just means you taking care of yourself, you making sure that you actually are able to live your best life and in a way that um, you can manage and you can carry on with what you need to do.
Mm. Yeah, there's a lot to think about when making change. It's glad that we've got people like you in the world helping others.
Oh, thank you. Yeah, I mean, it's so rewarding to be able to work with people and help them make changes. It's amazing.
Mm. Now, we're quite interested in your work in regional and remote areas because it's so relevant now. It's been revealed in the perimenopause and menopause Senate inquiry last year that there are so many underserved populations, including women in regional and remote areas who simply can't access supports. They might have to drive 4 or 5 hours to get to a clinic, or they may not know that the service exists. They may or may not have internet or patchy internet. And as a lead into talking about that, I'd love to hear a bit of backstory about your experience in working with regional remote areas and perhaps some of the lessons that you've learned through that process.
Yeah, absolutely. So I was lucky enough to work for the Alzheimer's Association in South Africa, going back a number of years. But I worked on a project where we were looking at helping to change the understanding in the rural communities around Alzheimer's and dementia. So very culturally based. It's plays into the same thing of just, how you understand what's going on with people, why are they behaving the way they are. So there it was really a matter of the traditional culture there was starting to see that the kind of belief system around it is that if people's and this was specifically elderly people who were now, exhibiting signs of dementia, they would start to think that, oh, something's happened to them. They've been bewitched.
Mm.
Uh, so that became, the more it started happening and the more people that were being seen like that, the the area and the people there would start actually then having quite a lot of violent behavior towards them, because they were now starting to feel as though these people were bewitched, they were evil, that they were coming to destroy them and hurt them, and so that project came, out, it stemmed out of that in terms of how do we now help these people and the surrounding loved ones who are not understanding really what's happening. And instead of providing support to people now who are going through dementia and Alzheimer's and having that struggle, they're actually being tormented. There was quite a few incidents of quite extreme violence towards them, and some of the loved ones as well. So that project, we then worked with the Department of Social Development and the Department of Health, and we looked at, how do you disseminate that information to them in a way that's going to be meaningful. So, from a cultural perspective, it's about what they're going to actually pick up and accept. And just to be going in from a kind of Western perspective and giving them information around it wouldn't work, because they think, well, that's not our belief. We don't buy into that. You're coming from another place. You're trying to enforce your belief systems on us. So they disengage with that. So the approach that we took with that was about training. So we did kind of a train the trainer program where we trained the social workers in all the different remote and regional areas. And with them, we went through obviously the actual scientific understanding of the illness, how it works, all the different signs and symptoms, all of that kind of thing, from the actual basics of the conditions, what they could expect, what they could see, and then how obviously to support people when they're going through that, how to support the people who are supporting them, all of those type of things from a factual point of view. But then it was looking at, okay, how do we actually, get this information into the areas of the people who are now remote and struggling with it. And that was mainly then they would just incorporate it into their daily lives. So they did, various different talks and programs and that within their communities, but they also just then started having the conversation, starting to make it, a normal thing to discuss. So trying to break down that barrier of it being, oh gosh, something to fear because we don't understand it. Just weaving it into conversations with everyone they were having in their local areas, so that it becomes something that's talked about. Because if you're not talking about it, how do you learn about it? How do you understand it? And so that was the kind of main approach. And yeah, it was amazing to be part of.
Yeah, it sounds incredible. And I can see a lot of lessons that translate directly into how do we reach regional and remote communities in Australia. I mean, what I heard first of all is, what is the common language? What is the glossary of terms that we all understand, and we have that common language as a grounding to talk about things that might be uncomfortable or unfamiliar or unknown, so that we can get that out in the open. And then I guess it's then about how do we share that with communities. And you've mentioned a trainer model, which is fantastic. The interesting thing is that obviously in Australia, for most of our regional and remote populations, we have trained people in those areas that aren't being accessed to their full capacity, perhaps, or maybe understaffed in some aspects. So I guess thinking about some of those things, I'd love to hear any thoughts that you have just at a high level as to what a couple of key steps or considerations might be if we're talking about how do we bring, let's say, menopause awareness, endometriosis awareness, those sorts of things. How do we bring that into regional communities in a simple and seamless way?
I mean, I would think the first kind of thing to look at would be, yeah, what resources are already there? What is it that they do have access to, so that it can be done in a way of being able to provide as much support without having to put too many extra resources in. But then also from a point of view of what are they already doing? Because I think with any information like that as well, it's about having their buy-in. And if you bring in things that are just too out of the ordinary and too foreign in a way, it can be met with resistance. So, who are they connecting with? Where are they going? Where is it that they do have access to? Whether it's just a woman's, support that they go and meet down the road with a few people, that they access as they're going about their daily life, or whether it's something more formalized like a clinic setting that they do have somebody there that they could go and actually chat with. So it depends very much on how it's set up. But those would be the first considerations that I would look at would be trying to utilize whatever's already in place and help normalize it into that situation, if that makes sense.
Yeah, I can see where you're going with that, and it sounds really logical. And it makes me think about the coaching approach where first you must build trust and rapport. And it's very much that, isn't it? It's how do we identify and leverage existing networks and relationships where people are already going and start those conversations and break some of the stigmas and help people to feel safe to open up and talk about things that are going on for them. I think the other part of it too is until we really understand what their experiences are of some of these women's health concerns, which is what you were saying earlier, where are they at? We have to understand that before we can, rather than saying here's a treatment or here's an approach or here's a program, let's first understand what they're going through, how they're experiencing it, what their needs are, what their challenges are.
Yes, absolutely. And that's exactly it. Like you say, from the coaching approach, it doesn't work if you just tell somebody what to do. You don't know what their situation is. You don't know, it's not going to be relevant to them as much as you think that you might. You have to ask them first. You have to find out what it is that works for them, what it is that they need to change, what it is they need help with. So it's about matching what's going on in their life already as much as possible and trying to integrate that into an understanding that, filters into their understanding of the world and understanding of um, their the way they see it and the way that they interact with it.
Yeah, it makes such sense. Thank you, Gina, for sharing your expertise and experience and insights on those things. I guess maybe to start wrapping up for this episode, and really appreciate your time here too. I'd love to know from you maybe what your aspirations are when it comes to helping women, your mission, what is a meaningful outcome for the work that you do that keeps you getting up in the morning and getting into it.
Oh, yeah, that's awesome. I mean, I I feel like any small win, any tiny movement forward with a client is just what I love about it. It can be something so small, but when you just see that somebody's making progress moving forward, and they're taking a step to better themselves and improve, and but I think for me as well, because I have this love and fascination of the way the mind works. And I don't want to say challenging, your normal way of thinking, but helping people to realize that just because you've always done it this way doesn't mean that that's the way you have to carry on doing it. Realizing that in any situation, you can take a step back and think, okay, what's actually going on here? Because I think so often we as people and humans and societies don't realize, things are kind of on the unconscious level that you're not aware of the decisions you're making and that it has all been part of a belief system. So just helping people to become aware of things. So I guess it's that awareness and then empowering them, as they then go forward in their lives later on where I'm not a part of it at all. It's just helping them to have that different way of thinking and be able to then call on those resources and question things in a way and think, okay, I can make a decision to actually change this situation. So, and it's any small step like that. So, I mean, ideally, I would love to be working with as many people as possible and helping as many women change and just supporting them as well, and helping people feel like they, yeah, have the capability and deserve the to put themselves in a good position, and that has such a ripple effect, I think. And that's the thing with women, it has a ripple effect on everyone else that they are, you know helping and supporting and prioritizing in their lives, because often they have that impact on so many other people.
Yeah, there's kids, there's partners, there's communities, there's social groups, women lifting each other up. And I think women often look to other women as role models more than perhaps men do to other men. I know evidence behind that. It's just a sense that women feel lifted up and pulled along by their friends, their peers, their role models. And that's part of that ripple
Yes,
effect.
absolutely, absolutely. So just having that support, feeling like you've got someone in your corner as well,
Mm.
is just so valuable.
I love that idea of being able to change the way you do things or change the way you think and see things for what they are and make a decision that you are in control and you can make a change. And it can just be a small change or an incremental series of small changes that can have a massive impact.
Yeah, absolutely. And I think that's the thing, is realizing that it doesn't have to be a huge thing. It can, obviously it can be, but it's just those small little things that build up on each other and actually make the big difference, going forward.
Thank you so much, Gina, for your time today. I really appreciate you coming in and sharing your knowledge, insights, and expertise.
Oh, thank you for having me. It's been a pleasure to talk to you.
I hope we can do this again.
Yeah, that would be
Okay.
awesome. Thanks
Okay.
so much.
Thank you.